Among the many blessings of my life, I count my long-standing involvement in the rare disease community. For me, that started when I met some of you back in the 1980s when I was HHS General Counsel. When I returned to the Social Security Administration in 2007, an agency where I had wreaked some havoc in my reckless youth, I realized that I had one last opportunity to try to make a difference for people with rare disorders. I couldn't help asking the question, when the prognosis is so certain and so dire, why is all this paperwork, why is all this process necessary? A very large, very paper-bound system really constrained the agency's ability to streamline the process in a meaningful way. I challenged my small but wonderful staff to expand the list of conditions, to double it to 200 by early 2013. Today's expansion brings us 2/3 of the way there to 165 conditions, and we look to all of you for your best thinking on how we can add an additional 35 diseases to this list before the end of this year.
Now, we can't do this task alone. Improving the science of everything from manufacturing to biomarkers to post-marketing adverse event surveillance is beyond the capacity and the resources of FDA alone. So we have formed consortia on many of these areas to try and bring the best minds together, all the different stakeholders from the patient groups, the academic community, and the industry, all to participate together to try and solve some of these problems. But the FDA staff, because we see all across the development spectrum, will always need to be engaged, and it is really part of our work in drug regulation to not only regulate drugs, but improve the way they are developed and assessed and monitored. This has been very time-consuming because we're really engaged in helping build a new type of science. And there have been a lot of two steps forward, one step back in many of these consortia. It's been frustrating, and there's a lot of work to be done, so I really thank all of you for participating.
I work a lot with many of the patient groups. I am the point person for the patient advocacy groups coming to our office. And I frequently hear questions about, how do we get our message out? How do we talk to reporters? How do we talk to writers? What can we do in order to get our message out to the public? We're a small disease. People haven't heard of us before, and we need to change that dynamic. So what I wanted to do was to rely on the experiences of others to try to get some of the lessons learned out and hopefully impart some thoughts in your head about how you may want to do the same for your diseases and the message you want to craft.